Hey guys, this is a session on hypertrophy. As you can compare the diagram, the two different types of cells. So what difference you can notice in the second diagram? So as you can see, the size of the cell have increased in the second diagram compared to the normal healthy cell. So increase in the size of the cell is called as hypertrophy. The word hyper means increasing, trophy is cells. So there is increase in the size of the cell. Moving on to the definition, hypertrophy, the size of the cells or the parenchymal cells have increased, done with the first point. There is due to increase in the size of the cell, there is increase in the size of organ. Imagine this is a organ. Imagine this is a liver. So this is the normal size of the liver. Due to increase in the size of the cell, the organ gets hypertrophy. There is increase in the size of the cell, and therefore there is increase in the size of organ. So what are the main causes for hypertrophy? It might be due to increase in the functional demand of the cells, or there might be increase in the workload, or there is increase in the tension of the cell. So there might be stimulation of any hormones or growth factor which made the cells to increase their size. Moving on to the physiological causes. So the best example is hypertrophy of the skeletal muscles, which you can mainly notice in the bodybuilders. As you can see in this diagram, so what you can notice is that the size of the muscles have increased. It is nothing but this is hypertrophy. So why there is increase in the size of the muscle? It's because of the increase in the size of the cells. So this is the best example for hypertrophy. Moving on to the second example, that is hypertrophy of the smooth muscles, which you can mainly see during the pregnancy. So there is growth of the uterus due to development of fetus in the uterus. So why does this occur? It mainly occurs due to estrogenic hormones, the hormones which will stimulate the estrogen receptors on the smooth muscles. Therefore, there is increase in the smooth muscle protein production, which makes the size of the uterus to increase. So these were the two important physiological causes. Moving on to the pathological causes. First one is the hypertrophy of the cardiac muscle. So where you can see the hypertrophy of cardiac muscle, it's mainly seen due to pressure load. That is when there is increase in the amount of pressure in your body, in your cardiac muscles. So it is seen during hypertension or aortic coarctation. Moving on to the volume load is seen during aortic stenosis and mitral incompetence. Cardiomyopathy. What do you mean by the word cardiomyopathy? Cardio is cardiac and myo is muscles. Pathy is increase. So there is increase in the size of cardiac muscles. So due to this, we can see there is hypertrophy. So it might be due to any toxic causes, or it might be hereditary or familial cause. Moving on to second example, that is hypertrophy of the smooth muscles. So you can see in urinary bladder, the best example is hypertrophy of urinary bladder. Why does this occur? Very important. It occurs due to any urethral obstruction, which is mainly seen in pyloric stenosis and prostatic hyperplasia. So imagine this is the urinary bladder. So when there is any urethral obstruction, in this area, so there will be increase in size of the cell of the urinary bladder, and therefore the size of the urinary bladder increases. There is increase in the size of the cell, which causes increase in the size of the organ or the tissue. This is called as hyperplasia. So the best example is pyloric stenosis, which you can see in the muscular layer of the stomach, and prostatic hyperplasia, that is, there is enlargement of prostate due to accumulation of some benign or malignant tumor cells. So moving on to the mechanism of the hypertrophy. So mechanism of hypertrophy. The hypertrophy is mainly due to three main reasons. First, due to increase in the growth factors, or there is increase in the contractile proteins, that is actin and myosin. Then there might be induction of fetal or embryonic genes. So we'll study this with the help of a diagram. So this is the mechanism of myocardial hypertrophy. So look at this diagram. As you can see, when there is mechanical stress, when there is mechanical stretch, that is during increased workload. When there is increased workload, there will be more and more tension, which will activate the mechanical sensors, mainly the integrin proteins. So, or there might be any agonist like the adrenergic hormones or the angiotensins, All of these will cause activation of agonistic receptors, or there might be any growth factors like IGF-1 or the TGF beta. All these things will activate the growth receptors. Mechanical stress, like when there is increased workload, there will be activation of mechanical sensors, or when there is any hypertrophic agonist like nitric oxide, angiotensin, adrenergic hormones, all these will activate the agonistic receptors, or the growth factors like TGF beta or IGF-1, they will activate the growth receptors. Once this step is done, so there will be activation of signal transduction pathway. So after the activation of signal transduction pathway, there will be activation of transcription factors. Very important steps to be noted. So there will be activation of transcription factors like the GATA4 or NFAT or MYC, FOS, June, others, etc. So once there is activation of the transcription factors, it causes three main things. Remember all these points. It's a very important thing. So there will be induction of embryonic or fetal genes like the cardiac alpha actin and ANF, or there might be increase in the synthesis of contractile protein like the actin and myosin, or there might be increase in the production of growth factors. The three main changes you can see due to activation of transcription factor are induction of embryonic or fetal genes, there might be increase in the synthesis of the actin and myosin, or there might be production of growth factors. So when there is induction of fetal genes, it increases the mechanical performance, it will decrease the workload. Very, very important. One thing to note here is when there is induction of fetal genes, there is decrease in workload. Whereas when there is increase in the synthesis of contractile proteins or increase in the production of growth factors, all these will increase the mechanical performance. So they'll try to increase the mechanical performance, but at one point when there is increase in the production of growth factor, it has to inhibit at one point. So they will try to inhibit the growth factors and tell them to stop releasing the factors, and therefore this cycle keeps on going. So that's it about the hypertrophy. So hope you like this video. So please do like, share, subscribe. Thank you.